Okay, good morning, everyone. This is the Incarceration Prevention and Reduction Task Force's Behavioral Health Committee meeting. We're meeting today at 9 o'clock on February 16th, 2021. And this is obviously a virtual remote only meeting. And before we begin introductions, I would like to do a call to order. This is item number 1. This is a land acknowledgement statement. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. And with that, I'd like to ask Jill Nixon to go ahead and just give us the gallery view back again. Okay, give me a second here, dealing with government equipment. Okay, I just want to go through, we've got new folks on the call today. And we've got new folks on the call today, and I just want to give everyone a chance to say, hello, good morning, and just kind of what you do, and just briefly your association with this committee. I'm going to just start as I see it. I see Chief Tanksley up in the upper left there.
Hi, I'm Chief Tanksley with the City of Blaine. Thank you.
Thanks, Chief. Arlene? You're on mute, Arlene.
Yes, I'm Arlene Feld, and I'm co-chair on the Legal and Justice Committee of this task force.
Thanks, Arlene. Stephen?
Stephen Gockley, co-chair of the Incarceration Prevention and Reduction Task Force.
And we've got a couple of new members here, and I want to give you just like 30 seconds more just to kind of say who you are. So Brian, do you want to go ahead?
Good morning, everybody. I'm Brian Thane. I'm Executive Director of the Bellingham and Whatcom County Housing Authorities.
Okay. Thanks, Brian. Thanks for joining us. Brian is new to the committee. Thanks for being here. Kathy?
Hi, good morning. I'm Kathy Smith, and I'm the City of Bellingham's Jail Alternatives and Diversion Manager. I'm housed at the Municipal Court.
Thank you, Kathy. Mike Hilly?
Yeah, good morning, Mike Hilly. I'm the EMS Manager for Whatcom County, and basically manage EMS system through our countywide levy, and working with the fire chiefs around the county as well.
Thanks, Mike. Britta?
Hi, I'm Britta Johnson. I am the Clinical Director at Lake Whatcom Residential Treatment Center. We work primarily with individuals who experience severe and persistent mental illness. And I'm very thankful to be here.
Thanks. Britta's new to the team this morning. So thanks, Britta, for being a part of this. Really appreciate it. Chris?
Yeah. Good morning. Good to see you all. I'm Chris Cochran, Mental Health Coordinator for Bellingham School District.
Thanks, Chris. Darlene?
Good morning. I'm Darlene Peterson. I'm the Court Administrator for the City of Bellingham.
Great. Thanks, Darlene. Mike Parker?
Yeah, Mike Parker. I work at Opportunity Council, and I'm honored to be the co-chair of this committee with Dan Himmel.
Great. Under Sheriff Doug?
Good morning. Sorry, I'm having some technical difficulties. Doug Chadwick, Undersheriff here with Whatcom County.
Thanks, Doug. Perry?
Good morning, folks. Perry Mowry. I am the Human Services Supervisor with the Whatcom County Health Department.
Byron?
Good morning, everybody. I'm Byron Mannering, the Executive Director at Bridget Collins Family Support Center.
Thanks. Jackie?
Hi, I'm Jackie Mitchell, Whatcom County Health Department Programs, Behavioral Health Program Specialist. I'm not actually on the committee. I just do want to make a couple of announcements when it's time to do that.
Okay, thanks for being here today. And Jill?
Good morning, everyone. Jill Nixon. I'm the legislative coordinator for Whatcom County Council and clerk for the task force and its committees.
Okay, I'm missing somebody. Who am I missing?
Nathan.
Oh, Nathan, sorry.
Hello, I'm Nathan Baima. I work at the Public Defender's Office as a behavioral health specialist.
Excellent. Thanks. Thanks everyone for just taking a couple minutes to do that. I know it's kind of laborious and many of us know each other and have worked with each other for some time, but we do have, like I said, new members today. And I think it's important to show the breadth and depth of this committee and the different parts from the various parts of the community where folks are coming from, where they can lend their perspective. So just wanted to thank you all again for joining us this morning, and we'll go ahead and get started with our agenda. And Jill Nixon, could you put the agenda back up briefly? Okay. So the first, number 2 item today is City of Bellingham Electronic Home Monitoring Program. And then here to take us through is Darlene Peterson.
Good morning again, everyone. I'm Darlene Peterson, and with me today, I have Kathy Smith, who you've already met. She's our Jail Alternatives and Diversion Manager. And I was asked to give a presentation about what changes we've observed in GPS and SCRAM with COVID-19. GPS being a bracelet that monitors somebody's whereabouts, generally used instead of jail sentences, and SCRAM, which is an alcohol monitoring bracelet that is used for alcohol monitoring. So with that, Kathy's going to go ahead and share her screen and we'll get started.
Thank you.
Right now I'm disabled from sharing.
Kathy, give me 1 second and I'll give you privileges to share.
Okay, thank you.
I think by the time we all figure these things out, we'll be hopefully all vaccinated and not have to worry about these things ever again.
All right, Kathy, go ahead.
Okay, thank you, Kathy. A bit of background for the program is that we entered this program in the beginning. It was designed to reduce overcrowding in the jail. We work with Friendship Diversion Services, which is a nonprofit organization. And as we said, we do both GPS and alcohol monitoring, and Friendship Diversion Services is the conduit through which everybody flows. We began the program in 2016. And at that time, we were just using bracelets as an alternative to jail. In the summer of 2016, we added SCRAM, which can do alcohol monitoring. They're separate bracelets, each with their own function, but they can be used in tandem. As we began monitoring the program, you will see that steadily from 2019, the program did increase with use. The cost of one bracelet is $14.50. Kathy, if you want to advance that screen, please. Next one. Is $14.50 a day per bracelet. If you have both, it's $25 a day. If you're on pretrial monitoring, the city pays all of those charges. So there's no cost to somebody on pretrial monitoring. And if you're post-conviction, we subsidize as a city so that lack of funds is not a barrier to anyone being on the bracelet. And we use 150% of the poverty level as our base. Again, as you'll see in the GPS enrollment, we steadily climbed through 2019 in use and then dropped significantly in 2020. The opposite in SCRAM, we continued to climb through 2019, but in 2020, you'll see that our numbers were higher. And so the one thing to note that that stood out to us is with this Scram enrollment, especially that our criminal charges that were filed actually dropped in half in 2020. And that was basically due to the lack of jail space and law enforcement basically booking people who had DUIs and assault fours were, and some of the charges that probably would have been given in 2020, they very much limited what they were arresting and charging for. At this point, I'm going to have Kathy take over, and she'll tell you some of the things that we observed and how that made a difference. Kathy?
Thanks, Darlene. So again, just kind of referring to these enrollment numbers, primarily looking at the GPS enrollment, which we had a significant drop off in 2020. We attribute that to the fact that the court was actually closed in April and May. We closed, I think, March 26th or somewhere around there. And we were completely closed to the public, had a skeletal staff working, and we weren't holding any telephonic hearings. So for those 2 months, we did not have any defendants resolving their cases. The jail was implementing booking restrictions, so even the number of defendants that were being arrested and booked had dropped. And so that's why our GPS enrollment dropped pretty dramatically in 2020. For Scram enrollment, you'll see that that went significantly higher. And we kind of attribute that to the fact that Scram is typically required for repeat offenders. So those that have had a previous DUI, city prosecutors were typically asked for Scram monitoring as along with being monitored by probation. And just kind of anecdotally, we feel that because of the stress of COVID and folks not having access to treatment services such as AA meetings, etc., they were just consuming more. And so we had more repeat offenders that were booked in, which is typically what the jail was accepting. And then we also had folks that were maybe on their first DUI arrest and weren't originally ordered to have Scram, but then at some point violated their pretrial release conditions by consuming or maybe picking up another alcohol-related arrest. And so in that instance, probation and city prosecutors will typically ask for Scram to be attached to further help the defendant comply with those conditions. So that's the reasons that we feel the Scram enrollment jumped up so high for 2020. So again, kind of leading back to the GPS reason, you could see that the amount of days ordered were significantly less in 2020. And again, we just attribute that to folks not being able to get their cases resolved during the 2 months that we were closed. And even though we're holding hearings telephonically, because they're so much more labor intensive than an in-person hearing, as opposed to having 40 defendants in a court hearing, we're typically limiting to about 15 defendants per calendar. So because of those limitations, defendants just aren't able to process through their cases as quickly as we were doing when we were meeting in person. And you see again, just the toll that the court being closed and folks just not being arrested. With the booking restrictions, they're basically, we're only taking DV related cases. They were taking DUIs initially. And so again, folks just weren't getting arrested and then weren't resolving their cases. So our average time days on GPS dropped significantly in 2020 for that. And then again, kind of the opposite, you can see that the total days on Scram jumped significantly in 2020. And again, just a lack of resolution in cases meant that folks were on the device longer. For the first time in 2020, I think we saw a couple of folks that were actually on a scram device for over 500 days. So that's, almost a year and a half on the device. And we just weren't seeing that prior to COVID. And that's kind of what I was referring to. Up to 2019, we had, 2017, 2018, we had nobody that was on for more than 400 days. In 2019, we had one defendant, but in 2020, we had 5 defendants who were on the device for more than 400 days. And there's some of our scram compliance numbers. The city columns on the left, the national averages on the right. And you can see our compliance rate in 2020 dropped rather significantly. Again, we attribute that to the fact that folks were on the device longer and then weren't having access to their treatment providers and just weren't getting the support services that they needed. Even once the online AA groups and online treatment providers started, we, just sitting in court and hearing folks tell their stories, they just either weren't comfortable with that or it just wasn't working for them as well as the in-person meetings. And so Ronnie, who's the deputy director of FDS, told us last week that they're seeing that across the board and really nationally, even though the national number for 2020 only dropped a percentage, they were seeing an overall compliance drop nationally in as far as alcohol monitoring. And our percentage of sober days is still pretty good. We average usually between 99.5 and 99.7% sober days. So again, the fact that we only dropped to 99.1, that's still an excellent sober days rate when compared nationally. But again, it did show a bit of a drop. And again, it goes back to the same reasons we talked about before, as people were just struggling to access services and to stay sober. And Darlene asked me to give us a couple of examples of our COVID-related issues that we would not normally see for specific defendants. So I think we picked one that came to mind. This defendant was arrested in March of 2020. So that's kind of when everything hit COVID-wise. And this was her second DUI arrest. She was released in order to have the scram device attached because of that prior arrest. She did not do that. She failed to report and did not get the device attached until April. She did finally get it attached in April, and between April of 2020 and September of 2020, she had 15 consumption or tampering violations while on the bracelet. The court issued a warrant in May of 2020 and actually requested that law enforcement pursue because we felt that her continued drinking and possible driving was a danger to the community. But unfortunately, because of the booking restrictions that were COVID related, the jail refused to accept her. So our warrant officers did not pursue her and did not make an arrest. In August of 2020, she did appear telephonically, got her warrant quashed, and she actually pleaded guilty to her charge. She was sentenced to be on the GPS device and, of course, required to keep the scram device on while she was on serving her sentence. However, between August of 2020, when she was sentenced, and January of 2021, she had 18 additional consumption or tampering violations. And some of those were multi-day drinking events. So even while she was serving her sentence on the bracelet at home, she was continuing to consume. And so, of course, Judge Led became very concerned about this, as was probation. Probation ended up revoking her in January, and we were able to reach out to the jail and get permission from Chief Jones to go ahead and have her booked in, because our concern was that if she was revoked and spent the next 60 days, which is what her revocation recommendation was, on the bracelet, that she would just simply continue to drink. And we felt that at that point, serving her sentence on a GPS bracelet just wasn't a safe alternative. So she was booked, and she's currently being held in the county jail to serve the rest of her time. And then another similar example is we had a defendant arrested in December of 2019 for an assault case, assault 4. Because of her pretrial violations of her release conditions, which included consumption of alcohol, probation in the city asked that Scram be attached for monitoring. And that was just attached in February of 2020. Again, kind of like our previous defendant, she did not initially enroll, and she wasn't actually enrolled until March of 2020. And between March and June of last year, she had 9 consumption or tampering violations. Again, the court issued a warrant for her arrest because they deemed these continued drinking violations to pose a danger to the community. And unfortunately, the jail initially refused to book her. And we had to reach out again to Chief Jones, explain our situation, our concern about public safety. And we actually did get permission, and the jail did agree to accept her, and we got her booked. So she is still on pretrial status with the court. And since being released from that initial warrant, she's only had 1 violation with Scram since being released. So I think those are two examples of non-DV related cases that we've had some issues, I think, protecting the public because we weren't able to get those folks booked in. And then obviously when they're not in jail, they're not getting access to any of their services outside the jail too. So hopefully this type of stuff will kind of go back to the normal that we saw pre-COVID. But for now, it's a daily task to kind of stay on top of violations and to do what's best for the community and for the defendant with the restrictions that we have in place. So any questions?
Okay, Jill, do you want to take us back to the full screen? Just
Sure. Kathy, can you stop sharing?
okay. Okay, I'm just looking at the screen here for questions. If you just raise your hand if you have a question. Mike Parker.
Kathy, thanks for that. And Darlene, thank you for the report. It's fascinating. And it's great to see the program progressing. And I'm just thinking about how many dollars have been saved and how many families stayed together. Kathy, your story of a couple of folks that really were struggling and sound very addicted to alcohol are really compelling. And I was curious, just in your mind, I know it was really challenging to get them into the jail, and that seemed to be the best and safest place. Do other diversion programs have other options at their fingertips when it comes to somebody who's so horribly addicted to alcohol and can't quite seem to stop it on their own? And I know our Crisis Solutions Center, it's not really set to be for that, for somebody to have that. But I'm just curious, if you had your druthers, would there be another solution that would be even better than jail for those 2 individuals who couldn't quite seem to stop drinking?
Well, prior to COVID, you know, we would have folks that would be making efforts to get into a treatment program. But what we found is that people were having difficulty getting beds. And so they might have a bed day, but it might be 2, 3, or 4 weeks out. And so other than the jail, that's really the only alternative that I think our community has for this type of defendant that was having, you know, some of these folks, we were getting 2 and 3 drinking violations a day from them. And I will say one thing about the jail is for the first defendant that I told you about, when I talked to Chief Jones, originally we thought that they could go to the work center where there was room. Because of her history and her struggles with alcohol, Chief Jones said, no, we want her at the main jail because that's where our folks are equipped to take care of her and make sure that she come in and is safe and doesn't have further health issues by being removed from that setting that she can consume in. So we were very grateful that the jail even with their booking restrictions, was willing to work with us and then also take the care of that defendant very seriously and make sure that she didn't further suffer once she was booked in.
But Darlene.
I was just going to add that every person that we have on a scram bracelet is also being monitored by probation. And that's part of our community safety wraparound so that these individuals don't fall through the cracks. And also in a prior life, having been with the probation department, treatment is always, when we see somebody in this condition, treatment is always the preferred method of dealing with it, because obviously they have a problem that they just can't control. And this has really been one of the biggest things that I feel has happened during COVID. As Kathy mentioned, the AA meetings, the treatment centers, you know, many years ago, we had actual inpatient treatment centers in Bellingham, as many of you probably already know. We have none now. And so to get a bed, people have to go outside the community. And with COVID, it's just been really hard. And the percentage of people getting treatment has just gone down so far. And I don't know if it's lack of ability to socially distance and continue these programs with COVID. I know that that's why in-person AA meetings stopped, but that's something that is really crucial in these kind of cases to help people get out of this cycle.
Thanks, Darlene. Arlene.
If you could design treatment or prompt treatment, how would you design it? Because you're the ones who are in the midst of everything and you know what we need. And so that's what I'm asking is, what do we need? How much of it do we need?
Well, honestly, Arlene, I think that is out of our realm. The court does not do treatment. And so that's not something that we would be involved with. I would say, the one thing I will say is for sure, if we had inpatient facilities available here for people to do treatment, I think that we would be serving our Bellingham folks that are addicted to alcohol much better, and it would be a much better program. I also believe that a lot of times they need to be longer. You know, somebody going to treatment for 16 days or 28 days, a lot of times that's just not enough time when you've been a chronic alcohol addicted person. And so those would be the only two things that I would see. But as far as what treatment works best and how it works, gosh, that's way out of our wheelhouse.
Right. Well, that's a really good answer, because those are two of the things that are really lacking in our corner of the state. And probably a lot of the corners of the state. I think that when I was working providing treatment, there were many people who had addictions for 30 and 40 years. Now, you can't possibly think that someone who's been addicted for 40 years is going to get what they need out of 1 month's treatment. It isn't going to happen. We need programs probably as long as a year. Now, I'm not saying you're going to go tomorrow and develop that program. I'm only telling you that it's important to have in the back of our minds what it is that we really need for people. Thank you.
Perry.
Ms. Johnson can certainly speak in more detail to this, but we're fortunate enough to have an inpatient facility that just in the last year, I may be a little bit off, has opened. And I'm just hearing some really great reports about the manager there and so forth. Obviously, space is limited, as was referenced before, and I certainly agree with the thoughts and experiences in terms of getting individuals into inpatient treatment. And I think that folks are aware too that the Recovery House program is also developing, which will still give a ASAM level 3 level of care. And so we're really looking forward to having that resource. So just wanted to make sure that folks were informed of that.
What's the name of that program?
Well, I think as Perry mentioned, we're calling it the Recovery House for now. I don't know if there's a different. Perry, are you referring to the Opportunity Council Lifeline Connections joint project?
I was, but maybe Arlene was making reference to the Lake Whatcom Center inpatient facility. I'll let Britta give some detail to that.
Britta, we've got no audio. There we go.
Thank you. Our residential treatment center is called Baker Creek. We shorten it to BCRTF. And our goal is 90 days as a minimum, honestly, for most folks. We do specialize in co-occurring, so individuals with both mental health and substance use concerns. I think the Recovery House will be incredible in our community, and I agree, longer term sort of step down transitional programs is definitely something that would be beneficial and fantastic. Baker Creek was impacted by COVID. We basically had to cut our capacity in half, and capacity was already fairly limited. Our licensing allows us up to 32, so 16 now. And while it's great that we have it, there's definitely a long wait list, and that certainly is a barrier.
I forgot that I had taken a tour of Baker House when it was first built, and thank you for reminding us and talking about it again. That's very important. And as you say, we need several.
I've got one question, and I want to give us a little more framing for this discussion for us to kind of walk away after to think about here. I think I understand the use of pretrial for Scram. That makes sense to me. I'm wondering about, for the GPS, the pretrial in lieu of bail, what charges would people have where they would be on a monitoring system versus just being PR'd, a personal recognizance?
Generally, Dan, those would be for people who are on domestic violence assault 4, and there's concern for the victim. And that's the most usual ways that you'd see somebody on pretrial GPS. Kathy, is there another one that you can think of?
Well, we do sometimes use it in lieu of bail. So if somebody, and I think it kind of runs the gamut of offenses. If somebody has $1,500, $2,000 bill, but simply can't afford it, then the commissioner, primarily because he handles in custody hearings, will put them on the bracelet until they are able to pay that bill. So he can ensure, say they've had a history of failure to appears or something of that nature, it kind of ensures that they'll show up for their court hearings without having putting any money down. And so if they say, well, I need 2 weeks to pay that $2,000 or whatever, then they'll be on their bracelet until it's paid. And then once it's paid, the bracelet's removed.
Okay, other questions before I launch here into my little, that's not a diatribe. It's more of a try. I'm trying to think about the complexities of what we're dealing with here. So to give new folks and other folks here some framing, the task force in its titles, Incarceration Prevention and Reduction Task Force. So we've been looking for ways to keep people out of the jail in whatever way made sense for safety of the community, for the health and well-being of the person, of their families, maybe of victims, definitely of victims. And so that's why there's all these discussions. We've talked about a pretrial risk assessment tool that was later implemented through a process. The PRing of people has been, my understanding is that courts are doing that whenever they can, which means that the person can just sign that I will come back to court and resolve my legal issues. And I'm promising to do that. It's like a promissory note in that regard. So I want folks to understand that there's been a lot of work on even like reducing or eliminating bail. to some degree. And that sounds like that the devices are kind of in that hierarchy and within that order to some degree. I know people probably don't want to wear a bracelet. I wouldn't want to wear two. I know you get the two for the price of not two. I don't think people want to wear both of those devices, but in some cases, I think the court has deemed that that's necessary. Okay, there's that piece. That's the court piece. And then the other piece is that we're dealing with complex psychosocial beings here, and some are going to have the co-occurring mental health and substance use disorder issues. And so how do we then as a community offer treatment options? And then how do we do that within COVID? And my hope today was that we could maybe think about how we reset coming out of COVID and really start to examine, inventory, understand, and expand upon the resources that we have. So we got the Lifeline, the Recovery House, Lake Whatcom's doing their piece. We have a Crisis Stabilization Center, and we all, or most of us, know that we're restricted on some of these items. Britta made a reference 16 and 16. That's exactly what we can do at the Crisis Stabilization Center. That's due to funding. We have to have those dollars to pay for these programs. There's no other way, and people we're not expecting our awesome healthcare workers to work for free. They need to be compensated even more, in my opinion. But that's sort of the reality that we're dealing with, is that we have some restrictions, some external restrictions that are that they kind of hamper some of the well-intended efforts of this group and this task force. I'm urging us to consider that we also, Bellingham City Council has directed the administration to come up with a response, an unarmed response plan for behavioral health, some behavioral health calls. So we are addressing this issue at multiple points in the sequential intercept model, which you should all have. And if you don't have that document, please reach out to Jill Nixon so you can get that. It'll help frame kind of where we're intercepting in the criminal justice system, but also in a person's life as they interact with that system. I wish I had more and better answers for you today, but that's kind of where I just wanted to get us thinking a little bit as we kind of progress forward in this committee throughout the year. And I'll go ahead, Mike Parker.
Dan, I was sensing that maybe we were going to move off the subject, and it just occurred to me that since we have Kathy and Darlene, I had another question that just popped into my head is, I know the program's been in operation for some time now, and I'm curious, and I haven't heard either of you mention that it's really meant to be a tool that ends recidivism and that stops it forever. It's really supposed to help the person deal with the infraction that happened. But I'm curious, do you in any way track participation in that program? And do you see people coming back and repeating? Do you feel in any way that Scram and GPS bracelets and that type of diversion from jail is in any way helpful in reducing the likelihood that the person comes back? Or do you not really have much data? I'm just curious.
At this point, Mike, we really don't have much data, but I will say since 2016, we do see a lot of the same people coming back. What I do know anecdotally is that people who are on the bracelet, rather than being incarcerated, can keep their jobs, keep daycare, keep going to school, keep going, so don't lose their housing, don't lose their children. There's so many benefits that those stressors can also be involved in recidivism. But at this point, we are putting every single person we can on a bracelet rather than having them incarcerated. So we really don't have a good way to follow, we don't have a control group where a lot of them are not going on the bracelet. And we just really haven't found a way to monitor that. We can go back. We have all the statistics or the numbers back from 2016 and maybe look at what percent are reoffending, but being able to compare that to anything, we don't really have anything.
Well, thank you for that answer. And I guess it would have been too great a hope that was this amazing stopgap tool that would serve all of that. But it occurred to me too that maybe from another standpoint, given that you are seeing some, and as Kathy's story, I just got the image of somebody who's really tortured by addiction. maybe there's some way in our system to offer folks in the future, in some better state, more or different treatment options when they come in contact with our criminal justice system to do a little bit better until they don't come back to the door. Thank you both for that presentation, though. It's really great work. I think Stephen had his hand up there.
I think Kathy wanted to respond to that, and then Stephen.
Yeah, I just wanted to follow up with Mike with your question about recidivism. I know for I had looked at maybe starting tracking recidivism for those folks that were put on the GPS device. And that's in the works. But I did look, if you look at the national research, nationally, most of the research points to the fact that whether or not people are incarcerated versus being put on a GPS bracelet, there's no correlation about those folks reoffending less than those that go to jail. So the research that's been done, if you just Google it and all the studies come up, it doesn't really show that just because somebody was put on a bracelet, they're less likely to commit a crime in the future. So nationally, that's kind of what we're looking at. I can tell you anecdotally for Scram that we have had defendants who have gotten sober and gotten through treatment on the Scram device and actually expressed concern about the possibility of the device being removed because they felt like it was a really good tool, that it was a constant reminder, that pressure on their ankle, knowing that it was a constant reminder that if they drank, there were going to be consequences. And a lot of folks have expressed their concern about having the device removed and wondering how successful they were going to be from that point forward. So anecdotally, for those that are truly ready to make a change, I think the device has helped them do that. It's a real-time, immediate consequence versus being tested at probation 3-4 days later and waiting for the court to respond and all that kind of stuff. So, but again, just anecdotally, we had talked about before COVID hit of trying to do a survey of all the defendants who had completed a Scram program, and then trying to determine, how they felt about it, how much it helped them, how successful they've been in staying sober. And then when COVID hit, that, kind of like some of our other initiatives, they're just kind of on pause, but we're really hoping to pick that back up this year and get that out there. And I think that'll give us some better feedback as to how the device is really helping folks stay sober.
Okay. Stephen and then Chris.
So recently, the task force has taken up another area of primary emphasis based on the findings we got from the Vera Institute 4 or 5 years ago, that there were disparities in the law enforcement and criminal legal system on race, ethnicity, and gender. So Mike's going to get us back to that later on this agenda, but I just wanted to ask Darlene and Kathy whether you track race, ethnicity, and gender statistically, whether you see any disparities in your use of the monitoring devices versus, I guess, jail usage. I mean, maybe this is all superseded by the fact that you're redirecting everybody into a monitoring system. But if you would address that in your domains, I'd appreciate that. Also, it occurs to me listening to Britta, and Britta, welcome to the committee. Thank you for joining us. Whether Baker Creek tracks data along those lines, and whether you notice any disparities in comparison to any other population you're dealing with.
Kathy, I don't know if you have anything to add on that. At this point, we currently are not. And at this point, as we said, anyone we can put on a bracelet, we are, regardless. And if you can't come up with bail, that's another solution, is to put anyone who doesn't have the means to come up with bail on a bracelet if it's deemed that we can't PR them or just let them out on their personal recognizance. But as far as any statistics, Kathy, I don't know if you have anything to add.
when we started putting together our spreadsheet to track the recidivism, I was including race in that just to kind of get those stats as well. But again, since that's kind of a work in progress, it's not something we typically track. In determining whether or not somebody can be on a bracelet post-conviction, we do conduct a risk assessment. It's based on prior criminal history, failure to appear history, kind of those types of things. And so that's what usually a conviction of a violent felony offense or a felony sex offense or something of that nature is the primary reason someone would not be eligible to be on a bracelet post-conviction. Otherwise, race or gender certainly doesn't play a part in how we choose who qualifies and who doesn't.
Kathy, just a real quick clarification to Stephen's question. It sounds like though you are capturing that demographic information. You do have it. It's just maybe not in any kind of analyzed state or maybe not very useful yet, but you do capture it. Is that correct? Did I get that right?
In the system we use, JIS, race is captured in that. And so when we start pulling data to dump it into a spreadsheet for whatever purpose, then that data would certainly be available to me to add a column for that.
Right, thank you.
Mike did hit on what my point was. We've run into a couple places in the system where we're not even tracking that data. So we couldn't go back and analyze against it, even if circumstances now didn't allow us to do that. And one example is the sheriff told us the FBI stopped listing Latinx people racially, and so we lost a year or two of data on ethnicity, and I guess it wasn't as clear to me how fully you were tracking those things. So if you're not, I understand we may not be able to analyze it under present circumstances, but if you're not, is there some way the task force can try to influence and expand your data capture there for future use?
Are you talking for our program specifically, Stephen?
Yeah. Well, and we're talking about every program. So since we would want your data as well.
Right. So where we pull our data from JIS, it does, each defendant's record does contain a race designation. So we could take every defendant that's gone through the program and probably within a couple of hours, I could assign a race to them and know exactly what percentage of folks were any particular race or any particular gender, if we needed to do that.
I want to give Britta.
I wonder if Britta could add anything from.
Yeah, I want to give Britta just a chance to chime in here, and then Chris had his hand up for a while here, and I want to get us moving along. But Britta, can you just speak to Baker Creek and your facilities?
Yeah, absolutely. So we definitely do track that for both Baker Creek as well as for just in general, we are required to track that data for our outpatient, basically any service we provide. So we do have a good data set that we can pull from. As far as Baker being that it is a relatively new facility, we have not done a full QM strategic analysis on any of that data yet. But I can say some of the trends that we see are that males are accessing treatment at higher numbers than females, and that we do see significant, a large number of individuals who are experiencing behavioral health concerns and also having legal challenges. So I think that our trends mirror some of the data that's out there. We, as mentioned, just don't have enough official analysis, but we could absolutely be able to get that data and run some numbers.
Hey, Chris, go ahead.
Yeah, thank you. Kathy, you referenced, first of all, thank you for your presentation. It was wonderful. You referenced that people on a bracelet are no less likely to reoffend later. And I was wondering, Britta referenced co-occurring approaches where you're looking at, not only the substance use, but also the mental health component. When they're inpatient, are there things the court is doing or can do to support or encourage that when someone's on a bracelet, so they're addressing those root causes? And you may have mentioned this earlier. I'm just wondering if there's a way to get to that before they're an inpatient.
Chris, I'm sorry, I'm not really sure if I understand your question.
Okay, so in other words, like if you have somebody on a bracelet who's continuing to have those offenses or violations and they're offending, my assumption is that there's a self-medication for underlying issues, regarding mental health or other things. How do we help those people access mental health services in a way that can help, promote ongoing sobriety before going to inpatient where a co-occurring approach would happen?
So most of that would be probably handled, and Darlene might chime in here, would be handled by the fact that they're also being monitored by probation pre-trial while they're on the device. And so as part of that pre-trial monitoring, they're required to get evaluations. So whether that's a drug alcohol evaluation or a mental health evaluation, that would be a call from the probation officer. And then based on those evaluations, they're required as they're part of their release conditions to undergo any treatment that's recommended as a result. So I think that's kind of what you're talking about. We've certainly had folks had their devices removed so that they can go into inpatient treatment, whether that's mental health or drug alcohol. And then we also have a mental health court. So if those defendants were showing that their underlying condition was mental health related, then they would be referred to our wellness court. And then that's kind of a whole separate program with a separate set of parameters. So I think those kind of two prongs will probably address what you were asking, that the court can at least play a role in.
And I would agree. The real place that would be picked up is during the evaluation. It generally takes a couple of hours, and going through that evaluation would hopefully be the place where they would catch that this isn't strictly an alcohol issue, their underlying mental health conditions or whatever they might be. And so at this point, that would be the place in the system where that would be captured.
Okay. Any other questions on this item before I move along? Okay, seeing none. I don't have the agenda up in front of me, but I think it's Shelter Plus Care is our next agenda item. And there it is. Okay, Shelter Plus Care. Yeah, and this is housing vouchers and housing for LEAD and GRACE members who are racially targeted. And Mike Parker's gonna take us through this. Mike might be attending to his newborn child. Give him just a second. Okay, while we're waiting for Mike, let's go ahead and go to the next item. I want to move to table the next item anyway, so I think we can just take care of that piece of business. The next item is the House Bill 1590 discussion. House Bill 1590 was passed last session, and that provides for local jurisdictions a 0.1% sales tax. So those like a county or a city could assess that, collect those revenues, and those revenues go towards mental health. At least 60% of those dollars need to go towards housing. More can go towards housing. I'm wanting to table this item because their policymakers have been discussing this sort of a fair bit recently with a little bit of intensity that happened at our last city council meeting. And I think that if we make a recommendation at this point, we're just going to be out of sequence. I think we need to wait until those policy makers have signaled their intentions as to what jurisdiction is going to go forward with this and what those plans look like. I think that we can support that effort once we have those intentions. But I'm gonna move to table this to the next meeting. And I'm looking for a second.
Second.
Okay, I think that was Under Sheriff Chadwick.
Correct.
Okay, thanks. All right. So the motion's been made and seconded. Is there any discussion? Seeing none. Oh, Marlene, go ahead.
How important is this bill, do you think?
Hugely important. It's worth, if it's countywide, it's $5 million a year. And if it's citywide, it's 2.8. If the county and the city split, the county would have 2.2. This is a lot of numbers. 5 million. 5 million is the overall.
Right.
It's really big.
Right.
And just consider that with the Bellingham Home Fund, which was started at $3 million a year, that home fund was able to leverage on capital projects. So building things, building apartment buildings, 12 to 1.
Yeah. So I would say that, you know, I agree with you, and I hope everyone in this meeting makes it their business to, if necessary, to campaign for this, because it's one of the most glaring gaps is housing. And for us to get funding for housing is stunningly important. And we can't do any of the things that we're trying to do without people being housed. So it's a corner piece to all of the expansion of care that we're trying to do in this community. Wow.
Yeah, it's a good thing. And I think Arlene's right. You know, if you've got relationships with your policymakers, send them an email. If you don't, do it anyway. I think it's important enough. And it kind of feeds into our discussion before about, you know, how do we fund treatment centers and things like that? Well, we can maybe look at some of the options through this as it comes online. There's also House Bill 1406, which passed. City Council made the recommendation to the county to say, you guys take it, $700,000 that we could be talking about. That could be an additive piece for our community. So I know those are a lot of House bill numbers, a lot of dollar numbers, but really these are two very good pieces of legislation. And I think, yeah, just tabling it right now, 1590 makes sense to me. So any further questions or discussion? Okay, seeing none, all those in favor, say aye. Aye. Opposed? Abstentions? I didn't hear any opposed or abstentions. So Jill, if you could record that as unanimous.
Yes, thank you.
Okay, and then Mike Parker, are you back with us? So his daughter's named Clara. She's very cute. Maybe she's out, and I think she's crawling. So I think that might be one of the animating conditions here, that he's probably chasing after her, or he's taking another call. Jill, can you put the agenda back up on the screen for us? Okay. Well, he's got 2 items today. I'm going to text him, but I'm wondering. Yeah, he's gonna take us through GARE as well.
Dan, I have a couple of announcements.
Yeah, Jackie, do you want to go ahead with those?
Yeah, they'll just take up not much time, but at least
go ahead.
You can get them out of the way. So I met with an agency called Acadia Health Services, which they own and run 7 opiate treatment programs in the state of Washington and several throughout the United States. And an opiate treatment program is a little bit different from a medication-assisted treatment program in that they provide methadone as well as Suboxone. And so they're very skilled at being able to provide methadone as a treatment protocol. And they've put in a request, petitioned the state to be able to run such a program in Whatcom County, and are hoping to undergo the needs assessment process that will be completed by the state and begin to open that facility in July. So it's kind of exciting news for us, I think, because I know we've needed one for quite a long time. And Lummi actually has an OTP, an opiate treatment program, but they don't provide any methadone services through it. So just wanted to let people know that was coming along. Any questions about that?
Jackie, you said the provider is Acadia, is that right?
Acadia Health Services, yes. They have 150 programs, I think, through. They're actually, they say they're the largest program in the United States. So I think they'll be able to handle and manage the sort of the public perception that comes along with and the stigma that comes along with managing such a program and managing the perceptions that people have about methadone as well. A lot of times people don't understand methadone as a treatment. And it's one of the most studied drugs and researched medications actually in the in the world actually. So.
Excellent.
And the other announcement I have is that Lifeline Connections, which was referenced earlier as the partner to Opportunity Council in the development of a recovery house, is planning an event, sort of a fundraiser for the recovery house. They're calling it Making the House a Home. And it's just to raise a little bit of money for just certain essential needs. They're going to come up with a list and I think put it on Amazon Wish or something like that. And let's see, the date of that was Tuesday, April 27th from 12 to 12:30. It'll be a virtual and a Facebook Live event. They're hoping to raise about $10,000. So I want people to know about that. And I'm sure more details will be coming out later. They'll have some guest speakers like Greg Winter and Ann Deacon, you know, famous people like that.
Okay, famous people. Okay.
Yeah, really famous people. You want their autographs.
In our world, they're famous.
Yeah, right.
Jackie, any other updates that you want to share?
No, that's it.
Okay, thanks for providing the committee with those updates. And Mike Parker, we see you're back. Do you want to go? Do you want to talk about Shelter Plus Care?
Sure. And my apologies, folks. I was my caregiver needed a little assistance with the care of my beautiful daughter. So I apologize for stepping away at an inopportune time. I wanted to thank our previous presenters too, Darlene and Kathy. I see they had to go, but that was, I'm sorry, I missed a piece of that. So really quickly, this came about actually on another call in one of our subcommittees, and we were talking about, you know, the efficacy of our programs and Grace and LEAD really doing some amazing things. We were hearing about LEAD being new and still working quite well. We're also acknowledged that working with individuals while still remaining homeless it is less positive as it would be if they were housed. Is there a possibility, for example, of targeting housing interventions for some of these, the folks that we're working with, that we're trying to keep out of our criminal justice system? So the idea came out, you know, we have some unused vouchers, Brian, very handy that you have joined our subcommittee at this time, but you know, the Housing Authority has some housing vouchers. So I don't want to go into too huge a detail, and Stephen's here and can talk a little bit about a phone call that we just like to explore and see, is there a possibility to be able to target some of these housing interventions? And it's not a lot. We're talking 10, 12, maybe Brian knows better exactly the number. But is there a possibility of using these maybe for some Grease and LEAD members? So I'll stop there, not to get too wonky, but you know, we already have the federal dollars. What we would need is some case management to assist them, because the Grace and LEAD case managers are quite busy doing what they're doing. So Stephen, I think I've teed it up kind of okay. Did you want to fill in a gap there and anything I missed?
I'll just say the Housing Authority has to turn back Shelter Plus Care money because it's not able to utilize it, in part because the capacity for the intense case management that has to go with it hasn't been available. So I went from one meeting hearing that report, happened to have the pleasure of being one of Brian's commissioners on the Housing Authority, to one of our LEAD or Grace reports and hearing the challenge that the lack of stable housing had for real success with the Grace and LEAD populations, and thought that we ought to be able to put those together. And Mike quickly educated me on how much more complex that is than I ever understood. we thought it would be worthwhile, and Brian was pretty enthusiastic in his support for doing this, to try to pull together just a small core team to discuss basically at a feasibility level whether this really might be doable. So we're in that most complicated stage of trying to put everybody's schedules together to have a first conversation. And 2 people from the Housing Authority, very knowledgeable in the area, are going to take part. Mike and I are going to take part. Melora Christensen, Development and Property Manager at Opportunity Council, Wendy Lawrence, and Beck from the Health Department Housing Programs, and Samuel Lutz from the City of Bellingham Housing and Development Programs. I think that's the core team to start out talking about it. If it looks like we have something doable there, we'll probably expand the discussion, because there are more stakeholders we want involved in the nuts and bolts of this stuff, and we'll see where it goes. It's a shot at dealing with a couple of different bottlenecks that we have in the community. So Mike thought it was worth taking on.
So just a couple of quick things, why it's on this committee's agenda, because it actually came in a legal justice presentation. 90, maybe more, 96%. Britta also works with the Housing Authority as a sponsor agency. I would say almost all of the folks that Opportunity Council serves using these types of funds have a behavioral health disability. They also have frequent incarceration backgrounds. It does not have to be solely a behavioral health disability for most of these HUD programs, but functionally it really is. And when we were talking with Grace and Lead folks, wow, this is really some of the folks that they're dealing with. I did want to comment on one additional thing. I see in the agenda that it's for racial targeting. And one thing we do need to be careful about, and that might have been from my language. So I do want to be careful with that, because, you know, any funds that come from HUD do have to fall under fair housing. So in terms of specifically targeting somebody for whatever color they might be, whether they're a minority or not, isn't something that's really doable. What we can do, though, or what we do know, is that people in our system, right, in frequent incarceration, that is a way of targeting people who are underserved and severe poverty and have severe disabilities, and also have a higher likelihood of being a person of color. So I just wanted to clarify that. And if anybody had any questions, these couldn't be used, to my knowledge, to specifically target one race or another. But by virtue of the pool of Grace and Lead participants having a representation, we hope to be able to address any disparity. So I hope I've said that in a way that makes sense. And please, if there's any questions or comments, please do add.
Stephen.
Yeah, I'll just underscore what Mike said. I too was surprised to see that in the agenda heading. That's not been part of our organizing conversations. I wouldn't expect it to be an explicit goal of the development activities. I think the effects will probably be somewhat along those lines, all to the good, but that's not how we're trying to shape or target this discussion.
And I would add, and I know that Ann Deacon's on here too and knows a lot more history than I do, but you know, the health department is obviously invested in people in all phases of needing housing, and has worked with Citygate and has beds, you know, specifically targeting folks that have been kind of criminal justice affected. This is a way to build upon and expand successes. This is not not necessarily brand new per se, but it is an expansion of things that work. And pairing it with Grace and Lead, I think, would be novel. So hopefully there's room for us to possibly figure something out here.
Last point I'll make, and just to emphasize the huge role the health department plays in these kinds of efforts. Not only are they lending us and Beck to take part in these conversations, but Gail DeHogue from the health department staff and vast housing experience in the community is also going to join us for the conversation.
I have a question for Mike or Stephen. The vacancy rate in Bellingham has gone up to 3%. And so we see building permits just flying through the system in either pre-app, app, or building. And I'm wondering, is that helping in any way with, could that help in any way with these vouchers, or is that just not a factor?
I might defer to Brian. I can tell you this. I mean, Opportunity Council, and I think to what extent Lake Whatcom Treatment Center too, as a sponsor agency for this grant, we've actually been able to find landlords even in the tight market, and part of that is a lot of relationship building over a lot of years. Even during the really tight 1% markets, what was really more the issue, and Andy can probably chime in on this, was really more case management. But all things are an issue, Dan, and having more availability is going to help anybody who might have a voucher or rent assistance. It is certainly going to make it easier to rehouse individuals with vacancy. It was so tough, and you'd see people putting in 4 and 5 applications, just chasing the few vacancies around town. It's not functional for those individuals. It's not functional for the system. So I would say it will definitely help. And Brian, I don't know if you have anything more specific on, and if you've been seeing that change.
Haven't really been seeing much change yet. And I'll just echo that it's been access to case management that's been the primary barrier to more fully utilizing our Shelter Plus Care vouchers.
So I'm going to editorialize for a second here. So this absolutely reinforces my belief that there's a lot of work to be done in workforce development for social service workers to pay them more. We need to attract workers, retain those workers. These are hard jobs. They need to be paid more. They should, in my opinion, this is just my opinion, I think that they should be paid the same as police officers. I know that that's kind of shooting for the moon, but we really need to figure out a way, we being the bigger we, on how to make that happen so that people take those jobs and can afford to live here to some degree, and provide the important treatment pieces so we don't have these gaps within our system. Mike Parker and I talked about this initially because he had mentioned that these vouchers were going unused. And to have a resource in a system to go unused is just, it's really not, it's just not, yeah, it's not really a good thing. And we see this with shelter beds that are, we have between 60 and 80 that are unused at any given time for a variety of different reasons. It's maddening, to be quite frank, that we have these opportunities, and because of system challenges or whatever the item is, it's stopping people from accessing, in this case, housing and some services. So I'll get off my soapbox, but I do think that I would urge this committee to think about ways that we can support. I don't know, maybe it's legislation, maybe it's just the things that we talked about before, maybe it's new items that Olympia that they're looking at, but we really need to build capacity within that, in that system. Any other, go ahead, Stephen.
Yeah, I'll just add on a little bit to that, Dan. I do think the capacity you're pointing to, the housing capacity is a plus, as Mike and Brian both said. But think about the population that this is really directed at. These are extraordinarily hard people to work with, co-occurring disorders, exacerbated by trauma over years, exacerbated by chronic homelessness. So this is not run-of-the-mill case management that's required. And it's not just the capacity to move into housing, it's the capacity to maintain housing and to maintain a relationship with a landlord that will work with a client like that. So it's really a complicated and intensive process. But I think we have some possibilities here, and really I haven't seen these possibilities crop up so clearly with an intersection of a couple of systems like housing and case management. So That's why I said Mike's conclusion, which I respected a lot, was this is worth having the conversation over.
Thanks for adding that, Stephen. And I totally hear you. I think we should, because of the things you said, we should fund all those things. We should fund and support all those levels of care, and including the ones that are the most complex. Mike, did you want to?
Well, Dan, I don't know whether you already talked about advocacy, but I'm hearing that call, and I think there are things in session right now that would be helpful. Some of them bring additional dollars to the homeless response system. Some of them change the legal capabilities and are asking for a just cause eviction, which is HB 1236. HB 1277 seeks to add $100 per real estate transaction, which would bring real dollars to Whatcom County to help us do these solutions that you're talking about. So if this committee would accept it, I'd be happy to share some information from the Washington Low Income Housing Alliance, which is kind of our advocacy thought partner when it comes to housing and homelessness. Because if any of you in your capacities or in your organizational capacities can support some of these key bills and capital budget provisions, we really could be looking at a better late in 2021 and 2022 funding picture. So if people are amenable, I'm seeing enough nods that if you don't wish to receive it, please just delete it. And Jill, if that's okay, I'll share some things with you to send out to the committee, specifically with regards to housing and homelessness advocacy in Olympia.
I firmly think that this administration is going to be sending funds for housing, and I just don't think it's going to be #1 priority, and it's going to take a while, because I know it's on their list. Also, mental health help is also on the federal list of this particular president. So, of course, you can't hold up the whole world, but we can try. And I think we're in a really exciting and hopeful time, in spite of the difficulties, because these expansions and these possibilities are now becoming possible and even likely. And I think all of us need to do is keep nudging everything along. And I'm especially grateful for those of you who have caught these various problems and work together to do teamwork to fix some of the gaps and the difficulties. I think it's one of the most marvelous things about this task force.
Thanks, Arlene. So Mike, if you can send those pieces out to Jill so we can get them circulated. And just as a heads up for folks on the call, we are going to be talking about legislative priorities at the next meeting. The idea, I think Anne adroitly addressed this by saying we could have talked about them today, but if those bills die in committee, it's kind of pointless. So let's kind of see in the process where they're at. This is the long session, so let's give that until next month and see where the bills are at. But if Mike can send those out, then we can at least know what we're talking about for the next meeting. And any further questions on this item? Okay, seeing none. Mike, do you want to take us through the last item, Gare?
Sure, yeah, this is going to be a little brief. I intended and was unable to make a GARE information session. So for new members on this committee, the Incarceration Prevention Reduction Task Force has formally adopted using the GARE Racial Equity Toolkit. This committee particularly, and Dan and myself are working on operationalizing that. And what Dan and I talked about, we do plan, by the way, outside of these meetings, what we talked about was that it would be very helpful for people to see how this might work, how this might actually a decision-making process using the GARE toolkit. So I've registered for another one of these sessions, which will give me some tools and understanding also of the benefits of membership, because if I'm not mistaken, and maybe Heather or Stephen know more recent details, I believe Whatcom County is at least still thinking about becoming a GARE member. But regardless of that action, this committee has already done so, and this subcommittee is needing some of that direction. So I just wanted to update that I will be attending one. I will send out the information, by the way. The informational sessions for GARE are open to the public. And so I will send that out if anybody else from this subcommittee group would like to attend that. I believe they're about an hour to an hour and a half. So along with the advocacy information about housing that I mentioned earlier, I will also include the GARE information session. And then Dan and I talked about that for our next meeting. So in addition to getting some talk about advocacy at our next meeting, we're gonna flesh through a bit of an example of how the subcommittee might employ a toolkit. So that's my promise to you all, is to go and do that necessary homework. I'll share that information session, and I'm really open to any questions or comments or any other thoughts that somebody might have on this subject.
Any thoughts? Any questions? Okay, I think you've got direction that to move forward as you will. Okay.
Outstanding. So I will look forward to that, and we will make sure that we cordon off a little bit of time on that agenda to be able to kind of work through that example, and then hopefully that gives us kind of a foot forward for the remainder of 2021 to be able to use it as we need to.
Okay. Thanks. Thanks. And then I'll just briefly buzz through our next meeting agenda items are the committee updates. We'll go over those again. I just want to keep the side rails on this moving forward into the rest of the year. Ledge updates, we covered Arapahoe County Handle with Care program. I was hoping Byron could stay the whole time, but I'll reach out to him. Byron's the executive director of Bridget Collins Family Support Center. I do want to have Chris Cochran's take on this program, as well as law enforcement. I'm hoping Chief Tanksley and others and Under Sheriff Chadwick can maybe talk about this. That program is a trauma intervention program that's used in Arapahoe County, Colorado. And we examined it, and we didn't make a recommendation on it last time. I think it's worth revisiting. That's why it's on there. And then identifying connector points in the system and facilitating a strong warm handoff process. Those are the items for the next meeting. Is there any other business today for the good of the order before public comment? Okay.
Dan,
yeah, go ahead, Heather.
Heather Flaherty, community representative. I was also taking care of my child through this meeting. So I just had a couple of comments and questions. I might have missed some details. But what I heard this morning from the Scram presentation, I just feel compelled on behalf of the community to say, like, our goal is incarceration reduction and prevention. And the Scram tool, although it's a great step because it allows the people to keep their housing and childcare, and but to hear those stories, I just heard pain in that experience. And maybe it's because I don't know the details of what the public safety risks are, but I was just thinking about the people I know who have struggled with addiction, how tough that is. And I really appreciated your comments, Mike, about are there options before jail, and what is the treatment capacity? And I think I probably missed a really important part of that answer, but I want to just emphasize that the reduction and prevention of incarceration is so key, and the diversion to what is so key. And Scram to me seems like another form of incarceration. It's a pre-carceration. And so it's a great tool, but what else could we have and develop? And I hope LEAD will help with that diversion piece, but I know it just seems like it's never enough. So that's my comment on that. And then the second thing, GARE, Mike, just to answer your question, my understanding is that the county has put it in their plan, the plan for children and family well-being. It's part of that plan. Astrid Newell at the health department has been shepherding that along. And so I do believe the county is working on becoming a member officially. I haven't heard a status update about that. I still think it's really valuable for this committee to be engaged and move forward regardless of what the county does. And the second piece is that the Racial Equity Commission is, we're working on developing that, and hopefully that will be a really great tool in our toolbox as well, and good partners in how to apply and implement racial equity lenses to this work. And I would really strongly encourage, if we're able to get racial data on the SCRAM participants, like that'll be a really critical piece too to look at to ensure there's not disparities in that program as well, just like we want to do across all the systems. So those are my comments, and thank you for asking and your patience with me. I appreciate it.
Thanks. Thank you, Heather. Kathy or Mike, do you have any response or not? Okay. Fair enough. Okay, I think thank you, Heather. And any other business for the good of the order today before public comment? Okay, Jill, let's go to public comment.
Yes, we have 2 attendees to the meeting today. If either of you would like to speak to the committee, please virtually raise your hand now. Yeah, no hands are raised.
Okay, just give me a second here. Okay, looks like our next meeting, thanks everyone again for attending today. Our next meeting is, sorry, let's see, March 16th, and that's at 9 a.m. So unless there's any other business, I'll go ahead and adjourn us. Okay, thanks for coming everyone today. Take care.
Dan Hamill and Mike Parker, if you could stay behind for a moment.
Will do.